Good morning, everyone. 11 o'clock, a big wave. Hello, sunny, beautiful fall day. Gotta love that. Feel free to take yourself off mute for a second if you just want to say a big hi.
Hi, Nestle.
Hello, hello. It's good to hear voices on the other side. Great.
Oh, okay.
Hi, everyone.
Hi, hello. Hi, Tom. It's a nice hearty wave. Good. Thank you. Oh, it's good to see faces.
Good afternoon.
Bye.
Oops, yep, it
Hello?
is.
Hi, Simon.
Just.
I know many of you have not met me in person, but it's great to have this first introductory visual. Hi, Linda. Good wave, everybody. We should do like goofy waves or something. We'll give it a couple minutes here to start. I should say this is being recorded, so keep that in mind. I'll mention that again when we get started.
Now you tell us, Leslie.
Yeah, right? I know.
That was perfectly done.
On film, yes. Great. All right. Full house. Exciting. This is our third installment, our final installment. Sad to say, but we will be here at Verdant Health Commission offices to help address any questions after this too, and keeping our website up to date. But this is our third and final installment of the pre-application Q&A. My name is Leslie Silverman. I am the Interim Director of Community Impact and Grant Making, and I am joined by my sidekick here, Erin Boehm. Big wave, Erin, Interim Grants Manager, and we're here to support you as you kick off your, some of you may have already started getting into your proposal request, begun to put your proposal together. We're hosting, we've had, as I said, this is our third session. The first one was big picture overview. And then after that, we took in lots of your feedback and decided to have a more focused, content specific call for the next two, which was around, the last one was on outcomes and the program narrative, the actual narrative of the proposal. And this one, the focus will be on the budget and the attachments, which might sound like it's fairly dry and may not be too long, a few minutes, but actually we've got some good slides for you that hopefully you'll find to be helpful, and some resources that follow at the end. All of the calls will be recorded. You can find all of the recordings and additional information on our website that we can show you at the end where to find that under funding opportunities. So you can always go back or have other colleagues or show it at lunch if you like. So whatever works. All right, so I will jump in. And I am so grateful to Erin to be driving slides. She's amazing. So for our the first slide at the top, or did it, there we go. Okay, so great. Just an overview at the highest level. Most of you may be familiar with us, I'm sure. We are public hospital district number 2, Snohomish County, and our board of commissioners and employees make up the team and administer the grants, the classes, the wellness center that we have here. The voter elected board of commissioners includes the 5 commissioners members that you see on the right there, and they govern the organization. They'll be reviewing the proposals, all the proposals that are advanced, and making ultimately the decision on the end of January. And we're also comprised of 8 full-time and 3 part-time employees, and you can find more information about that on our website. So we'll go on to our next slide, please. This is a reminder of our service area. You'll see this on the website too, so it'll be important to check back on this after you've put your proposal together to make sure that it's aligned with the Verdant service area. And again, it's very similar to the Edmonds School District area too. So there's a great amount of overlap there. All right. And next, we'll just move into our, at a high level, our funding priority areas. For those of you that have not heard, we in late 2022, or actually in the summer, fall of 2022, we Verdant Health Commission made a decision to narrow our are to focus our priority areas on mental health, healthcare access, and food security. And we're really excited that we can have an opportunity to go a little bit deeper into these strategic areas and learn more from you and others that are working in this space and with populations that have these needs to see how they're being met in Snohomish County. Great. And some of the changes that have been made in our in the grant making from the past to this year is that our funding approach, as most of you know, is now gone from 4 cycles to 2 grant application cycles. And so we're in our current cycle that just opened November 1st, and then our next cycle will open up on May 1st. And we are awarding annual grants now. There'll no longer be the renewal or continual funding. This gives us an opportunity to learn more about where we need to pivot, what's working well, what adjustments to make. And so we're hoping that we'll have the opportunity to learn more from you about what's working well. And there will be no new COVID-19 funding after the end of 2022. The need and demand for that is not as great, given hopefully we're seeing progress on that front, and that we would not have a need for any new COVID funding. And then some changes to the online application. We've been talking about that on previous calls, but mostly to know that we'll be asking you to select a primary area of funding, the primary strategic priority for you. Do not feel any pressure or do not feel like you have to select a secondary. It's entirely optional, but we just know that many of you are working in a space where you might be working with both mental health and healthcare access, for example, and we'll ask you to choose a primary. Later, this comes into play when we're asking for outcomes. We're going to want those outcomes to really be supporting the primary area that you selected. We're also asking for those organizations that have gross revenues greater than 2 million, they provide a statement of financial need. And that's really an explanation of how additional funds will be useful, why this request is needed for your organization. And we're also wanting to learn more about other partners that you're working with, specifically other funders who are contributing and how they're supporting the good work that you're doing. And we've added a confirmation page, like acknowledgements, to say that, that you understand that this is a 1-year contract and that the application is complete. And there's a host of questions just to be sure. It's more of a checklist that you can, hopefully it's useful to you to see it as a checklist to go through that and see that everything has been addressed in your proposal. I know I'm going really fast, but I want to get to the meatier stuff. So we'll continue on. Again, most of this is, you'll find all of this, including this slide deck, on our website. So this is just a few things to call out here. We're not looking for any range for the proposal request. There's no minimum or maximum. I mentioned here that our average last year was 100,000. However, we expect this year to be very competitive. So to keep that in mind and to be, realistic on what your needs are. And we're not awarding for any, capital or equipment requests that are solely capital equipment requests, and largely supporting direct program expenses. And yeah, we'll continue on. And this is just a big picture of the timeline. I will just highlight what you see in yellow here. And so in yellow, that time period between November 4th, when the applications, the portal opened up, to December 2nd, the deadline. That's the opportunity for applicants to be working on their proposal and developing their request. And then it'll be submitted December 2nd by 5 p.m. And we will have staff will be spending much of December reviewing proposals and into January, when the commissioners will have that opportunity. And we are aiming for a decision by the end of January. And then the next slide gets a little bit more specific about what's happening during that time period. And so I won't spend too much time on this. This is a lot of text here, but mostly to see that, we have sort of what you see in dark green are really is more applicant-led activities, if you will, and the lighter color is happening here at our office at Verdant Health Commission. So for you, there'll be a period of, asking questions, entering the online information, submitting your application on December 2nd, 5 p.m. Did I say that? Yes. Then we'll have our internal review. And then for new applicants that have not yet met Verdant or have not been part of the Verdant portfolio, will want an opportunity to meet with the board just to learn more about you. And then final decision end of January. So we'll continue on there. And I should add, if you have any questions at this point too, or even throughout, please feel free to raise your hand. We want this to be just open conversation. We'll try and address them as we go along. Also, feel free to put them in the chat too. So at this point, most of this has been probably fairly high level information you're familiar with. This is just to note that during the review period, the staff and commissioners will be assigning a certain weight to the different components of the proposal. And so when we look at the type of impact that you've described in your proposal, that will have about a 40% weight. Looking at community need, we'll have about a 25% weight. How you describe the implementation and how it aligns with the need is about up to 20 points or 20%. And how you've described your outcomes is 15 points. And we do recognize this is a one-year proposal. This is a one-year term that you're going to be asking for support, and that, to be realistic in what you propose for your outcomes. And we have a more in-depth Q&A about that from our last, it's on our website, from our last call. But we recognize it may be more outputs and to some degree, short-term outcomes. Okay.
I just had a question.
Yes.
In the chat. What is the capital cost limit?
Yes, we'll be getting to that. That's a great question. So awesome. That brings us into, I think, our budget categories. Yes. Okay. All right. So stay tuned. We'll be there soon. So here, I just wanted to make sure that you're familiar with our online portal. It's a system called Flux. There's many systems out there, and Verdant Health Commission contracts using the system Flux that's designed to support all the grant requests and ongoing reporting. And so you'll want to first make sure that your organization is registered. So if you are new, you'll want to, that'll be the first step. If you are already in the system, you'll want to make sure that your contacts are up to date. We understand there's sometimes turnover and changes in staff. So you'll want to take that opportunity to go through the organization contacts listed, and it's a great time to bring that up to date. And then you're ready to begin your request. And there are great tutorials that we have on our resources site. Erin may take us there later towards the end if folks have questions, but if you have any questions on the how to, let us know. And then there's 6 application sections, and today we're going to focus on budget and documents. All right. This is just a note that in the beginning, when I was writing proposals, I sometimes was confused about operating budget and program budget. So I just wanted to make clear that the program budget is specifically those costs that are associated with the project that you're seeking to fund for the period of time the grant covers. So an operating budget could be, you might have, chances are it's an annual budget, but it might be for a different time period. It could be for a calendar year. And the program budget that you're seeking funds for this, for the Verdant request, would be like April 1st, for example, to March 31st. So that they are slightly different. And so our focus today is on the program budget for the request. Okay. Next slide. All right, preparing the budget. So 2 important things that I want to communicate in this slide. One is save often. So we've learned that there's not an auto save in Flux, and so, or at least not in a timely way that is to our benefit. So we're going to encourage you to save often after you've entered some substantive information. Second is always remember to check, there's not an auto check here. So when you put in your dollar amounts in your budget, you want to make sure that that sum total, it will sum total it for you, but it's not testing it or checking it against what your grant request is. So you want to be sure to make sure that those 2 numbers align, that they agree. Okay. Next, these are snapshots of what you would see when you enter the Flex system. And so it'll ask you to enter the start and end date of the project. And for this November cycle, we expect that the default for most of you will be to enter April 1, which is the start of our contract date, through the end date of March 31st, 2024. There may be some of you on this call who are current grantees now with Verdant, and you have an end date of June 30th. If you do, and you're electing to apply now, we ask that you apply for a 9-month grant so that you can keep the funds that you have now through June 30th, and that you would enter your start date as 7/1, and it would end March 31. Happy to go over that with you offline. I know I've talked to some of you already, and so we can talk more about that if folks have specific questions on how that would work. But we suggest that you keep the current grant that you have now through June 30th. So, all right. Next is looking at the different budget categories. So if we can go back to the slide before, Erin, thanks. So I didn't point out, but there's basically 3 main budget categories: personnel, direct, and indirect. So we're going to go over those. And then there's always that other category. So the personnel cost, the main thing to point out here is that obviously this includes salary and benefits that are directly supporting the program. So you would only list the paid personnel that relate to the project in the application. But what's important to point out here is that we're not asking you, it's completely up to your discretion, whether you want to indicate the salaries by position and list them out individually, which I know some nonprofits understandably may be uncomfortable with that, or you can put it in a lump sum, and that's fine to say collectively salaries are here and collectively the total benefits is this amount, so that you have, that amount showing. And then in the notes section, you would use that to indicate, to say, well, we've got 3 full-time staff, we have 2 part-time social workers on this, and this is how we expect them to use their time. So that would be really helpful to us to understand what makes up some of those large dollar amounts. So is this optional or required? The personnel, is that the question, Michael?
Yeah, that's correct. So I think it says optional in the Flux application. I just want to confirm. 'Cause we had a
Oh, that
conversation
personnel
about that
costs are
yesterday.
optional?
Yeah.
Oh, absolutely, because you may not have any personnel costs. So I'm glad you asked that. Yes.
But if we do, you want us to list them?
Not by, it's up to you if you want to list them line by line, but we completely understand that there might be some sensitivities around that.
Yeah.
And so you could just put one, whatever it may be, $100,000 might cover 2 part-time staff. And so you can just put in the notes to say this is to support 2 part-time without all those details. Does
Okay.
that help?
Yeah, that's great.
Okay. I do want to emphasize here, this is really important to get across, is that these are it's a 1-year grant term. And so we recognize that this can present a hardship for some organizations that are dedicating some dollars in their budget to support a salary. And so we do ask that you keep that in mind, of course, and I know this has probably come up with other funders as well, is that you need to think about how to sustain that position and how to ensure that it won't have, an adverse impact once the grant ends on your activities. So it's, we recognize that's very challenging. So we understand that. And it's a difficult position, but at the same time, we just want you to be cognizant of that, of course, that you are finding other ways to seek funds to support those positions, those roles. Okay, is there another comment, or is that all of them? It might be.
Well, the one from earlier
Oh,
was,
yes.
what is the capital cost limit? And I can actually pull up the budget document. So,
It's 5,000 for aggregate.
yeah.
That's good.
So
There it is.
here
Oh, good.
Is the minor capital expenses definition. And then the major. And it says Verdants County does not fund major capital items.
That's great. Thank you, Erin. You can find that in the downloads on the Flux site when you're in I'll show you that later. Okay. Super. Okay, we'll continue on. And so then that brings us to direct costs. And so these are, other than personnel, which was reflected in the category above, direct costs are those expenses that are and many of you have done this already, but for some of you that may be new to this, direct costs are those expenses that are allocated specifically to support the program. So training costs, materials, transportation. Again, we encourage you to use the notes section generously to explain calculations for large amounts. So, for example, I included here, if there's some transportation or travel costs, you'd want to say that, we expect, 10 trips, to Bellingham or something estimated at such and such for, 3 days a week or something like that. I don't know. I'm just making that up, but if it's for some training or something, whatever it may be. So anything that can help to give us an understanding of the larger dollar amounts would be really useful. Great. And just to note that these are expenses that would not exist if the program didn't exist. So they're directly connected to supporting the program. Yeah. And then there's indirect costs, which are often, termed as overhead charges. And so these expenses are not allocated to a specific, they're not allocated directly to the project, but instead they are going across multiple programs or locations. So sometimes this might be electricity, phones, memberships, other charges, administrative charges. And so similar to, I think, comparable to many other funders, the indirect cost rate we are supporting is up to 10% of the request, of your total request amount. Great. And then the minor capital costs, we just mentioned that. So 5,000 in aggregate. So that covers it. Thank you for asking that question. And then just a reminder, and this is in the funding guidelines as well, which is on the website, is that Verdant funding cannot support those requests for individuals or any kind of pledges, not for direct religious purposes, lobbying, not for major capital expenditures or scholarship funds. And also subcontracting is not permitted. It's very unusual, and that would be something to discuss with us if you needed to enter in that kind of an arrangement. Okay. And these are just some general tips to always keep in mind. So whether it's with Verdant or with other funders, and I feel like it bears repeating. I've read so many proposals, and sometimes I see a disconnect. And so I think these are good reminders to be sure to understand the funder's requirements before preparing your program or research grant budget. Just check the format that's needed. In this case, ours is fairly straightforward. It just has these 4 fields. It's got the other as well that you can enter additional information, but our template, I think, is fairly straightforward. But to understand what we can fund and what we cannot fund is really important. And this other step is, to me, is also very important, is to work with your other team members in your organization or that you're partnering with, to be sure that you understand that you've incorporated all the costs that need to be covered, or that they're realistic requests. And so you'll want to work with them. And so oftentimes there's 2 or 3 people that are working on a proposal to help put these pieces together. And you just want to make sure that it all aligns, which brings us to step 3, that making sure that your grant budget aligns with your narrative. So if you're talking about hosting a big training, you want to make sure that you have dollars to support that training in your budget. And then I think we had some other just general tips, is just understanding the time period covered by the grant. So in this case, it's 1 year, or for some, it may be that 9-month stub period. And that allows you to create a realistic timeline for your budget. And then just be concise. I mentioned, to be generous in your budget notes, more for those larger expense items, but you don't need to get into the details around administrative or smaller expenses like supplies, pens, whatever it may be. So just being realistic about that. Again, what would a reader want to know if they're reading this? What questions would they have if they're looking at your budget? It tells a story. Okay. I'm going to stop here for a moment and just take a breath and see if you have any questions related to the budget. And we will, we'll have time at the end as well. But before we move into the attachment section, which has about 5 or 6 more slides, does anyone have any questions?
I had a quick question. So you said if we have the current grant funding through June, we should do break it down to a 9-month grant request. So will the funding request, should we kind of adjust that to fit a 9-month schedule as well, versus sticking with our 1-year ask and maybe not being able to use all the funds? Like how should we
Yeah.
approach that?
Yes, you'd want it to, I mean, you want to be able to have, you want to have a budget that supports the 9-month term. So
Yeah.
just that it realistically supports that. So,
Okay,
good question.
appreciate that. Thank you.
Mhm. Are there other questions on budget at the moment? And again, we'll have time at the end too, so,
Yes, Leslie, I did have one. This is Tom Lang from Letty.
yes.
If we have 2 grants going and one of them is off cycle from the other, so with respect to the 9-month comment, is it possible to request that one of the grants terminate early so everything falls into cycle and I could write one grant application rather than write a 1-year one and a 9-month one?
Yes, if
'cause
I
I'll-
understand
'Cause
correctly.
I have one that ends on June 30th, which means that if I apply for it now, I would apply for either 9 months to start on 7/1, which would be fine, or I would apply for the entire year. Because there's also another grant, I have 2 grants that are on different cycles. So I'm trying to get them on the same cycle, basically.
Oh, yeah, that would be great. So one ends June 30th and the other one ends when?
One's not going to end until next I think it's October or something like that.
Right.
So
Yes, you could look at bringing them together and one might end up being for that, kind
Yeah,
of stub period that, or truncated period, I should say.
yeah, because what I was looking at was basically just to adjust the budget so that the one program has 9, or well, actually to put it all on an annual cycle and then just request to cancel the second contract that had 3 months remaining.
Right. Yes,
Is that acceptable?
yes, I think that would work. I think that makes
Okay,
sense.
because it'll get me on cycle without having to adjust my budgets and do different
Yeah.
pieces, and maybe you have to write 2 reports. So, all right. well,
Right.
Thank you for.
And
Thank
Tom,
you.
I'm happy to talk with you too after
Okay,
the
wonderful.
call. So if you want to
Sounds
just
good.
talk through more of the details. Okay.
Thank you.
Other questions? Okay, I think we'll go ahead and move to attachments then, which seems pretty straightforward, but we just want to walk you through it because it's the kind of thing when you start getting into the portal, like what do we put where? So I'll turn it over to Erin. She's going to help us walk through this.
Great. Do you want to mute yours? And I'll unmute
Oh, absolutely. Mhm.
All right, so hopefully everyone can hear me. Did you mute your? Okay. All right, so going through the attachment section here, you'll see when you're in Flux and you scroll to the very bottom, you've done all your narrative, the budget, the document uploads are at the bottom. Here you can see the 2 required are list of organizations, board of directors with their affiliations, and then 2 years of organizations, financial statements and audits. Audit requirements may be waived for small organizations. The other piece is earlier in the application, if you said that you needed to upload letters of support, that also would be something that would be required. And this is kind of the layout here. Number 1, we have financial statements or audits. 2 are the required documents, 3 optional, and then 4 organization documents. Just a reminder here, and this is in the instructional link here, if you were to click on document uploads to get more details. Applicant and grantee organizations that have annual operating expenses greater than 3 million are required to provide Verdant with a copy of a financial audit performed by an independent accounting firm. Audited financial statements must be provided to Verdant annually. So just a reminder there. And then when you click on each of the sections, so for sections 2 and 3, this would be the drop down for when you upload the document and then you tell us what that document is. And then after that, you'll click save. And then here's the drop down for the organization documents. So again, the board of directors upload is required. The financial statements or audits, depending on the size of your organization, is required, and then the letters of support. Any questions on attachments?
Yeah, just a quick question to clarify on the letters of support. Are those required or only in some cases or recommended, even if they're not required? What kind of guidance do you have on that?
So let me pull up the part of the application. Great question. So during the section where it talks about you're talking about your key partners, if any of the key partners are critical to the outcomes, that's when letters of support are required, but otherwise it is not required. And there's more details on letters of support here, but great question. You don't have to, upload tons of letters of support if they're not critical to the outcomes of your program. Great question. Any other
Great, thank you.
questions on attachments? Okay.
All right. So just making sure, okay, good. All right. We have the muting thing going. So
I'm
this is
sorry,
just
may I ask
also
a question?
Oh, yes, please.
Sorry, this is Deb Brandy. On the letters of support, so like if you have 4 or 5 letters of support, do you want them copied into one PDF file or uploaded individually?
Either or.
Yeah,
whatever's
doesn't matter.
easier for you.
Did you hear that too? Yes.
Yeah, that's great.
Yes. Okay, great. Good. Yeah. Whatever's easier for you, it's fine. That's great. And then this is just providing a few resources that are out there. This first one, Washington Nonprofits, it's really big picture. It's a great guide, just understanding like financial statements, what all that means. It's just, it's free, accessible to you. It might be useful if you have a finance person in your office that's getting up to speed on the nonprofit tools needed. So that's more big picture. And then there's a couple of other resources here that are more specific to a project budget. So great. Good. And the next slide. Oh, that's great. Thank you. Yeah, thank you. Oh, of course. Yeah. Aaron is fast. And we also will show you too that we've added to the website, I think it's on the website, a template of the grant application. So the funding guidelines do have a list of all the questions, but we thought if it's helpful to you to have a tool that you can put in like a Google sheet that you can share with other team members in your organization, that they can all weigh in or review your responses before you go into Flex, that might be useful to you. And so we can show you where that is too at some point, but I just wanted to make mention of that while Aaron was putting some information in the chat.
So I put the template in the chat as well.
Right.
And then
That's great. Those are just tools and ideas if you need them. Again, I feel like our budget's fairly straightforward, but if it just helps to have that as a guide, that's great.
Just really quickly, since we were just talking about the template.
Oh, yeah.
So if you can hear me in the application, when you're editing it, you'll be able to see a link that shows the Verdant application template. I also put it in one other place. So if you click on that, it's not for you to actually upload your application. It's just for you to work with your organization to do things offline. So to download it, you just select file, download to Microsoft Word, but it's still required that you update and submit online. So just something that we added last week. Okay.
Yes. Can we delete a pending request in Flex if we accidentally created two?
Yes. So just message me or just don't fully submit it, and then that will be fine. So whatever one you submit is the one that goes through, and then the pending ones, don't worry about those.
But if it's confusing for you, just send an email to grants@verdanthealth.org. Great. And then this is just noting that we have, additional tutorials, as we've mentioned. We've been providing Q&A sessions. This is our third one. We are, offering technical assistance in the spirit of transparency and to also provide equitable access to information. The technical assistance will be specific to, I can't get into Flex, or it's not accepting this or that, whatever it may be. But the FAQ that we put online will be one that is up to date with specific questions you have around the proposal clarification, or, is it better if I submit, a proposal for 2 programs or 1? So we want everyone to have that information. So that will be shared in one place. And as Erin mentioned, there's an application template that's can be useful for you to work offline with other team members in your organization. And we'll be uploading, we have a board meeting, a public board meeting on Wednesday morning when the scorecard will be approved going forward. So we will be able to post that online after that board meeting.
And I'll put that link very close to where the application template link is at the top of the page. And I highly recommend you don't submit your application until you go through that scorecard, just so that you can see what we're going to be evaluating the application off of.
Great, thank you. Any other, I think that was the last, the deadline. So we went through quite a bit there, but we have time for any questions that you have. Was this helpful? Is it clear as mud? Any clarifying questions?
Hey, Leslie, this is Linda. I just want to double check. Can you hear me?
Yes.
Great. I just want to double check that what you're talking about is going to happen on the 16th is a more detailed scorecard description of what exactly people are going to be looking for in the grant applications. And it's going to be like a rubric that has more details than the slide that just shows X number of points are going to go to this, X number of points are going to go to that.
Absolutely, yes. Yeah.
Is the 16th a meeting? Is that another meeting?
No, we just said on Wednesday, there will be a public board meeting on Wednesday morning from 8 to 10 in the morning. It's maybe on our website. I have to check, but that's a board meeting. And then after the scorecard is approved, and there may be some changes to make, we'll see whatever we need to do. Our goal is to get that up on the website on Wednesday, the 16th. So we're just sharing our communication plan.
And Erin, you were saying that that'll probably be up at the top somewhere where it's easily found, correct?
Yeah, let me pull up the application again so I can show you right where I'll put it.
On our website.
I can have Kirk add it to the website as well, but where I'll be putting it is when you are at the top of the application, I'll have another link right here so that anyone who is filling out an application will see those links no matter whether they're going on the website or not. I just want to make sure that everyone who will be submitting an application will see those links, but I can also have it added to the website.
Thank you so much, because that, of course, will be super helpful. The other question I had is, Leslie, could you just talk a little bit more about, I'm just trying to figure, one of the things we loved so much about Verdant, and we've been partners with Verdant since Verdant was born, is the multi-year funding. And so could you just talk a little bit more about when you were saying earlier about the 1 year of funding, we can continue to apply every year, correct?
Correct.
Okay.
And yes, you can continue to apply each year. At this time, there's no, I think some funders might say you can apply, for 3 years and then step aside. And so whatever it may be, but there's no, there are no parameters or restrictions around that. So you can apply each year.
Okay, good. Because
Correct.
I just wanted to make sure of that, because again, and again, I know that things have changed and I'm trying to go with the change, but I just wanted to make sure that there isn't any kind of assumption that you get 1 year of funding and then you're done.
No.
Thank you.
Nope. Nope. And I will remind folks too that there is a community forum this evening from 4 to 5:30. It's hybrid. You can call in or you can come in person, and it's an opportunity to talk specifically around. There'll be about a half an hour of just going over the strategic priorities and what changes have taken place that are impacting 2023 and 2024 funding. And then if there's any questions or comments, to feel free to express those. The commissioners will be there to listen and learn. So,
and there will be an option to submit anonymous questions.
Yes. Thank you. More questions, budget, attachments. I know, exciting. But hopefully it helps to answer anything that you were unclear about. And it'll be a little bit more straightforward when you do dive into these aspects of the application.
I don't want to hog the time, but I noticed that rent and occupancy was not listed in either categories. Is in your guys' view, is that a part of the program budget because it's required to have for the program?
Yeah, I mean, I see that as it's really dependent on the organization, on the request, but for most organizations, I see that as an indirect. It's allocated across all programs. And so unless your project is, maybe a meal delivery, and that's, the request is for the entire support of that site. But I will check on that for you, and we'll put that in our FAQ so that it's very clear. How does that
Thank
sound?
you.
Okay.
That sounds good,
Yeah.
because again, it's second to personnel. It's our largest expense.
Yeah, right.
And so I just want to make sure that we're putting it in the right category that doesn't raise yellow, red, or
Right.
purple flags.
Yeah, exactly. So I'd rather check with our finance expert in-house and put that into the FAQ, which we will have up by this Friday. Maybe before, I hope. Yeah. Questions?
Leslie, one other question regarding balance sheets and income reports. Is there
Yeah.
a time period specific that you want those reports centered around?
I think they're for the 2 years. Is this for the, 2-year reporting period? And so it would be, typically I've seen it the 2 complete years, 2 full years. So for example, if you're applying now in November and you're a calendar year, and again, I'll be sure that this is clear in our FAQ as well, but I would think you'd be looking at the time period of fiscal year ending 2021 and 2020.
Okay,
Yeah.
that's great. Thank you.
Okay. Good questions. Are there any others? Might have bonus time for lunch, maybe. Okay. All right, again, I would definitely stay on top of our, bookmark our website for the next month. And that's a place we're going to try and keep that up to date with questions. And then if you have specific questions, best to send it to grants@verdanthealth.org so that Aaron and I can both manage that. We'll be taking some days here and there where we're out of the office. And so by sending it to grants@verdanthealth.org, it assures that it doesn't get dropped someplace. Are there more in the chat? I see, or maybe they've already been addressed. Oh no, those are all the links that you added. Awesome. Okay. I think that might be it. You all have been a great audience, participatory and with good questions. And let us know if we can do anything else to help provide clarity, and go forth with your day and all the good work you're doing. So thank you so much.
Thank you.
Bye-bye.
Thank you.
Thank you, Aaron.
Thank you.
And